So next we'll start with tubulointerstitial diseases. So under that, we'll have acute tubular necrosis. So acute tubular necrosis is also called as acute kidney injury, and most commonly this acute tubular necrosis is going to involve the proximal convoluted tubule. So there are two major causes of acute tubular necrosis, and that will be either an ischemic cause or a toxic cause. So under ischemia, so whenever there is a blood vessel being occluded or obstructed, so what is going to happen? The part which the blood vessel was supplying is going to undergo ischemia. So only that part which is supplied by the blood vessel is going to be affected. So this is going to be kind of a patchy kind of a necrosis. So there will be patchy necrosis of the proximal convoluted tubule supplied by that blood vessel, and this is going to be the most common pattern. However, in toxic kind of an acute tubular necrosis, the toxin is going to enter the blood, and from there it is going to be distributed evenly. So there is going to be diffuse necrosis because of the injury caused by this toxin in the proximal convoluted tubule. So some of the common examples which we see in toxic ATNs will be ethylene glycol poisoning. So ethylene glycol poisoning, one of the features which we see in that will be calcium oxalate crystals. So presence of calcium oxalate crystals in large amounts in an ethylene glycol poison can be seen. Same for carbon tetrachloride. So in carbon tetrachloride poisoning, again you can see lipid accumulation. Okay. So the classical feature in which of this acute tubular necrosis will be the presence of this muddy brown casts. So normally casts are proteins which are formed from the Tom Harsfall proteins. So group of Henle is going to produce a protein called as Tom Harsfall protein. So that is going to produce the hyaline cast, which is a normal finding. However, on this hyaline cast, you are going to have some other kind of epithelial cells or some other RBCs, WBCs depositing in it. So that can form some pathologic casts. Similarly, there is one cast called as muddy brown cast, which is nothing but these necrotic tubular cells, right? So caused by this acute tubular necrosis. These necrotic tubular cells are going to accumulate on this hyaline cast and form this muddy brown cast. So muddy brown casts are usually present in acute tubular necrosis, and this is the urinary microscopic image of this muddy brown cast. Next, we'll see about chronic pyelonephritis. So, chronic pyelonephritis is nothing but an infectious interstitial disease. So, this infection is usually caused by E. coli, and the infection can either come from the blood or through ascending route through the urethra. It can enter into the urinary tract. And here again, there is going to be two causes for causing this chronic pyelonephritis. So, suppose if there is an obstruction, like there is a calculus or some tumor. So whenever there is an obstruction, the proximal part cannot, it will be dilated, and whatever secretions is there, it is going to accumulate. So there is going to any kind of stagnation, it will lead to an infection. So obstructive pyelonephritis is one of the major causes of chronic pyelonephritis. Other than that, we can also have reflux nephropathy. Like in a kid, there is going to be some congenital disorders wherein they can have vesicoureteric reflex. So vesicoureteric reflex can again cause excess of urinary formation, which is being refluxed. So that is again going to cause stagnation, and that will result in a infection. So in any kind of infection, it is going to cause chronic inflammation. This condition is going to produce chronic inflammation, and that will result in chronic inflammation and fibrosis. So whenever fibrosis is present, the kidney is going to be scarred, and that is going to be an irregular asymmetric kind of scarring in a chronic pyelonephritis. So since it is an infectious condition, you can see WBCs in the urine. So you can have pyuria. Along with that, we can also have the presence of WBC casts. So the same hyaline cast on which you are going to see these kind of WBCs. So all of these cells are the WBCs, and this is the transparent cast. If you see, you can see an outline. So this is the hyaline cast on which you are seeing this WBC, and then it is called as a WBC cast. So WBC casts are seen in chronic pyelonephritis. Then on light microscopy, if you see chronic pyelonephritis, it is usually affecting the tubules, right? So the tubules will be dilated. So they'll be dilated and thinned out. In this image, I'll enlarge this. So these are all dilated and thinned out tubules only, in which there is lots of accumulation of the tubular secretions. So it is looking just like a thyroid tissue, right? So colloid filled thyroid follicles. So it is giving that kind of an appearance, and that is why it is called as thyroidization of the tubules. So in chronic pyelonephritis, you see this thyroidization of the tubules. Other than that, you also see lots of interstitial inflammation. So all of these areas, it is all filled with some blue cells, right? These are chronic inflammatory cells seen in the interstitium as a response to this infection. So apart from that, we can also see periglomerular fibrosis. So around the glomerulus and also in the interstitium, you are going to see periglomerular fibrosis. So it eventually it is going to lead to tubular atrophy also. Okay, so these are all the features we see in a chronic pyelonephritis. There is one specific type of chronic pyelonephritis called as xanthogranulomatous pyelonephritis. So in xanthogranulomatous pyelonephritis, it is clinically going to present like a mass. So the clinician will suspect that it was a tumor and they'll take it out. So actually it is also an infectious condition, and usually the infection here is going to be caused by protease. So protease infection will lead to formation of this xanthogranulomatous pyelonephritis. So what does xantho mean? It is going to mean some kind of fat lipid accumulation. So it is going to produce a granulomatous reaction. So there will be macrophage collection which is filled up with these lipids, and that is what is called as xanthogranulomatous pyelonephritis. And usually protease infection, and in this case xanthogranulomatous pyelonephritis, is going to be associated with the formation of struvite stones and crystals. So what are these struvite stones? Struvite stones are nothing but these are triple phosphate stones. So they are going to be composed of three type of elements, mainly magnesium, ammonium, and then phosphate. Magnesium, ammonium, phosphate crystals will be there, and this will tend to form this struvite crystals, which can accumulate and form the struvite stone. The struvite stone is also called as the staghorn calculus. This just appears like a staghorn, right? It's just a stag is a deer, so its horn is going to appear like this, and this branching is because of its location. Suppose the renal pelvis, the stone is involving the renal pelvis, it takes the shape of that renal pelvis, so and it appears like a staghorn. So that is why it is called as a staghorn calculus, which is composed of the struvite crystals actually. So struvite crystals, they take up the shape of a coffin lid. So if this is the structure, this is going to appear like a coffin lid. So coffin lid kind of shape will be seen in a struvite crystals.